Hi, thank you so much for the invitation. I'm very happy to be here. I have many slides, but I will try to emphasize just some of the main findings that we, in some of our initial studies. And I'd love to hear your feedback because we are actually just in our second year. And so we're still working on issues and love to hear what your thoughts are regarding using this kind of data source. So we're using Google Street View as a way to automatically characterize built environments. So Google Street View is a relatively new tool. It was launched in 2007, and it's basically giving high resolution images at the eye level. So this isn't different from like satellite imagery where you're looking from the top down. So at the eye level, we have the advantage of we leverage it to kind of do virtual audits versus the travel costs and staff time of doing on-site visits. And so that's how we leverage this data source. So it's typically, these images are typically collected via cars, and they give you 360 views, so overlapping images. And the images are updated, but the frequency varies depending on population density and weather conditions, but also road access is another thing. So advantages include efficiency, researcher safety, because you're not going to potentially dangerous neighborhoods or traveling long distances, the lower cost, and your data collection is non-obtrusive, so you're not interfering necessarily with the neighborhood environment in that community. So we're going to discuss 3 different studies that we did so far. So the first is a pilot study using on 3 different cities. So one of the main things of the methods that we're using is supervised learning. So with supervised learning, you have to give the model a lot of training data. And the training data is key because if your training data is not reflected in the data that you need to predict on, then the model won't perform very well. So you need training data that's reflective of the data you actually need predictions on. So here we started with Chicago, and then we also found that it wasn't really, the accuracy was struggling in rural areas, so we added images from Charleston, which is a more rural area. And so over 15,000 images are manually labeled from by our team. And then we reserved 80% for training and 20% for testing. We use deep convolutional networks to predict built environment characteristics, and these have become more of the standard for object recognition. We obtained I was happy with the accuracy, so it was between 85 and 93% depending on the indicator that we're looking at. So these are accuracy just means the match between a manual label and a computer vision prediction. So those are pretty good levels, especially because we don't need to label millions of images, so that this is just based upon getting the computer to predict the indicator from an image. And these are just some example images that in our data set. So with 3 indicators, so green 30, that's basically 30% of the image is green, so composed of trees or grass. So this is tapping into the greenness of an environment, whether there's a crosswalk there or not. So there you see a crosswalk, and then whether it's a single-family housing community. So if there is a building that's not a single-family home, that would be a 1. So all these are dichotomous. Okay, so and this is like another example. So here green 30 is 0 because there's less vegetation, there's no crosswalk, and you see that this is not a single family community. And so this is a single family community and it's very green. And this is a good demonstration also of training data and how it can be helpful to you. So we had images in our training data from the winter season, and here, although the trees don't have leaves, the model can still tell that it's a green street. And so as long as you have that reflected in your training data, your model will be able to identify this as being a green space. And this is an advantage as opposed to other modeling strategies. For instance, if you're only looking at the color green, then it wouldn't be able to say that this is a green street, for instance. So there are advantages to using computer vision. Okay. So these are some images of the 3 cities. So for our pilot study, we looked at Salt Lake City. So Salt Lake is very unique. It has wide streets and is very green. It's a kind of a medium-sized city. Chicago, of course, is a very dense city. And then we have Charleston, which is more rural. The housing looks different. There's, of course, more vegetation. And then to examine whether these Google Street View derived characteristics predict health, we merged it with the Utah Population Database. I'm not sure if you're familiar with this, but this is a highly unique data set in that it has individual level outcomes on basically the population of Utah. So if you are a resident of Utah, you are probably in this data set. It merges administrative data, so that's birth outcomes, marriage license, divorce records, clinical records, residential histories. So all those are merged and de-identified. And the data is used by medical and public health professionals to examine, to do studies. So one of the studies is that we conducted. We merged our built environment characteristics, so Google Street View derived characteristics at the zip code level, with individual level health outcomes. And here it's obesity and diabetes. For presentation, we categorize our built environment characteristics into tertiles. So people in the third tertile have, for instance, the highest exposure to green streets, to crosswalks, to commercial buildings, for instance. And we're finding that those 3 characteristics were associated with better health outcomes. So, for instance, if an individual lived in a zip code that had the most green streets, they had a 27% reduction in obesity. So that was we didn't know what to expect, but these are quite good estimates for it being an environmental characteristic. And we controlled for in zip code level, population density, and demographics, as well as individual level characteristics as well. And these outcomes are at the individual level. The limitation is this is Salt Lake City, and so this is not other states, but we are actually merging our Google Street View data with NHANES and NHIS data to look at national patterns at the individual level. And those manuscripts are in progress right now, and we're seeing similar relationships. So the limitations, the data only captures a subset of community features. So Google Street View, before we got into this, we proposed other indicators like graffiti or litter, but those are actually quite small and difficult for the model to predict accurately. So when you're using computer vision, you are restricted in the type and diversity and depth of the neighborhood built environment characterization, but you gain efficiency and the scale is larger because you can basically conduct national and international studies with the images. And then the particular analysis with the Utah data is cross-sectional. So next I'm going to present on county health outcomes. So here we are looking at, we expanded our data collection to the US and we looked at county health outcomes, and we added some more indicators. One of the indicators we added was visible wires. So utility wires overhead as an indicator of physical disorder. So we expanded to the US, so not only just the 3 cities, but actually intersections across the US, and we collected about 30 million images. And these are just some examples of the images along with their indicators. So here, this is an image with like visible wires overhead. And also the number of lanes, so we did single lane versus multiple lane. We also did an indicator of 3+ lanes, but that was more rare. And another note about computer vision models, they struggle when the indicator is less than 10%. So because the model can just predict that there's an absence of the indicator, and then it'll be correct. And so for those models, we're in our year 2 of the R1. We're actually going to go after dilapidated building as an indicator, but that's actually very rare in the US. It's more prevalent in certain cities, but it's rare overall. And so we're definitely going to try to push to see whether we can accurately predict that for the US, but it's going to be a complicated modeling strategy. And these are some more images of the indicators. To do the analyses, it's basically an ecological study looking at county level, Google Street View images, derived characteristics, and controlling for county level demographics. Here's the prevalence at the county level of the various Google Street View indicators along with the health outcomes. Okay. And we were surprised. Crosswalks is one of those things that it was that the model performed really well on, even though the crosswalks is very small. Because then you saw images where the crosswalk was right in front, but then it predicted well even if the crosswalk was like in further away. So maybe because crosswalks is just like 2 lanes, so kind of like depending on the indicator complexity, you can get high accuracy if it's quite simple, even if the image is small. So just a low note if you're working in this area. So this is a county level analysis. We're finding that crosswalks is associated with better outcomes like we saw at the individual level, but this is at the county level. So for instance, people who live in counties with the most crosswalk had a reduction in obesity of negative of 1.4%, a reduction in physical inactivity of negative 2.7%, and also they experience less very poor health. Not single-family home, that's an indicator of more like mixed use. So mixed use, we are finding that it's associated with better outcomes, and visible wires as an indicator of physical disorder is associated with worse health outcomes. We also looked at analyses stratified by rurality. So here it was like a really simple measure, and there's different measures of rurality, but here is just at the county level, it's the percent of people who live in a rural area, and we just dichotomize it less than 50 versus more than 50. We're finding that adverse associations with visible wires are stronger in urban areas than in rural areas. So I didn't really go over the demographics, but there are demographics associated with built environments because, as you know, people don't randomly sort into neighborhoods, and different demographic groups are exposed to different built environments. Crosswalks in not single-family homes seem to be beneficial, and that's we're seeing that pretty consistently at the individual level, census tract level, county level, and state level. We usually, with our indicators, we generally perform analyses at all different levels, but we're finding pretty robust associations across them for our indicators. And the visible wires, currently, we're finding that associated with worse worse health outcomes. And the associations may also vary by rural status. So there are many limitations associated with Google Street View. I think one specific one is the time lag. So, which may be surprising because in urban areas the pictures are updated pretty frequently. But if most of the U.S. is rural, so there's a ton of rural areas, and those images are updated. It could be 3 or 4 years in time, and the quality differ across the different areas. And because when we get an image, we sample at road intersections, also street segments, and sometimes depending on your view, you can have a picture be from different time period. So that's kind of a unique problem. And then also certain features are difficult to identify because, for instance, Google Street View will blur the face. So a feature that is very potentially useful would be pedestrian detection, but Google Street View will try to mask identity, that becomes very difficult. And so it's just when you're using Google Street View images, you just have to kind of work with their data and play around with the models and kind of look at what the zoom level also matters to see what the model will be able to predict well. But a major advantage is it becomes very feasible to conduct large studies on neighborhoods because that's, I think, one of the major limitations of neighborhood research is a lot of times the neighborhood studies are very localized into one city or one location. And so the ability to expand out from that and to produce or do studies that are broader in geography can help you with the generalizability and to look at whether these patterns hold up across diverse geographies. It seems like Google Street View is a cost-effective way to conduct these studies. One, I guess, minor note, as I'm closing, Google Street View now is not free, so Google now charges for images. This was not true a year ago, and so people in this field of work will have to now contend with that. Just as, yeah. But I'm very happy to take any questions during the discussion, and I look forward to meeting you and discussing this further.